Today we're going to talk about the sacrum and the coccyx. Here's a review of the vertebral column. We're going to talk about the lower, most inferior part of the vertebral column. You can see the pelvic curve here that we're talking about. And this is the anterior view. And once again, this part of the vertebral column is anteriorly concave. Just like the thoracic, it's concave if you're looking at it from the anterior position. There's a lot of anatomy on here. The sacrum is made up of 5 vertebrae that fuse between the ages of 18 and 30 on people. Below that, the coccyx is also made up of 3 to 5 vertebrae that are also fused. The superior articular facets and processes on either side of the sacral canal on S1 articulate with the inferior articular facets and processes of L5 above. The anterior sacral promontory at the base of the sacrum projects anteriorly into the pelvic cavity. And you'll see that on the next slide on the lateral, but that's right here. The sacral ali are the lateral extensions of the body of S1. They join the ilia to form the sacroiliac joints. The sacrum attaches to the os cocci, or the hip bones, laterally at the auricular surface. You can see the auricular surface right here, and that's where it's going to join with the ilium of the pelvis. The os cocci are the ilium, ischium, and pubic bone that join together to form the acetabulum. These hip bones and the sacrum and the coccyx form the bony pelvis that protect the bladder, the lower colon, the rectum, and the reproductive organs. As we saw before, the sacrum is concave anteriorly. The female sacrum is much more acutely curved than the male sacrum, which is a lot more evenly curved and in a more vertical position. The sacral canal is a channel formed by each of the vertebral arches and spinous processes of the sacral vertebrae. The spinal nerves extending from the end of the spinal cord, which ends at about L1-2, and are called the cauda equina, which literally in translation from Latin means horsetail, pass through the spinal canal and enter and exit through the sacral foramina. Anteriorly, transverse lines or ridges form where the sacral bodies fuse, and you can see those right here anteriorly. Posteriorly, you have the median sacral crest, a midline ridge that's formed right here in the back of the sacrum that is the fused spinous processes of S1 through 3 or 4. The intermediate sacral crest are formed by fused articular processes of the sacral vertebrae, and those are located between the median crest and the sacral foramina, so right in here. The lateral crest are formed by the transverse processes of the sacral vertebrae, and they're located just laterally to the sacral foramina. The sacral cornua are horn-like inferior extensions of the sacral inferior articular process that articulates with the coccygeal cornu below. The apex of the sacrum articulates with the first coccyx bone. The sacral hiatus is a place where the laminae of S5 do not completely fuse, and you can see how it's open right here. And it gets covered with the sacral ligament in the back to protect the nerves that are still coming through the spinal canal at that, or the sacral canal at that point. The first coccyx vertebrae has transverse processes that form the inferior portion of the fifth sacral foramina, which is actually incomplete. You can see here, if it had completely formed, there would have been a fifth sacral foramina right in this area, but those are incomplete, and these transverse processes are pretty discernible on the Coccyx 1 and Coccyx 2. There's a little one right there. And the last three sort of fuse together, 3, 4, and 5, or 3 and 4, depending on how many people actually have. They can vary. The coccygeal cornu articulate with the sacral cornu as superior articular processes, but also they are incomplete articulations, and you can see that pretty well on the lateral on the next slide, where you can see where they come together but not quite articulating with each other. So here are the lateral views. The top image will show the sacral canal and the sacral hiatus in a sagittal cross section of the sacrum. So it's as if you've cut it in half. So you can see the canal and you can see the sacral hiatus. And here the cornus don't actually touch or articulate with each other. They're very near though. If you're lucky, you can see it really well on the lateral views of the sacrum or the coccyx, especially if you've got really no rotation on those views. These two images also show the curve variation that you might see between males and females. So you can see how this one is slightly less acutely curved and it's a little more vertical, and this one is very acutely curved. So it's you gotta have room in there when women are having children to have room for the baby's head. So they're a little bit bigger in that area, in the curvature of the sacrum coccyx. On this picture on the right, you can see it's a mid-coronal cross-section of the cauda equina. You can see all the nerves that come through. This is where the sacral canal is, and all the nerves that come through the sacral foramina. These are the coccyx bones, and like I said, everyone has, you can have 4 or 5 of them. The first two are very similar in having their little very tiny transverse processes, and the bottom 2 or 3 are typically fused. And once again, you have apex or base at the top, apex at the bottom, and you have the sacral articulation right here at the top. These are the cornu, the coccyx, the coccygeal cornu. You can see here on this view on the dorsal surface that the cornu are remnants of pedicles and superior articular processes of a typical vertebrae. So you can see if it had completely formed, where this is like the beginning of the vertebral arch posteriorly. Personally, I think it's fascinating. You guys might not so much, but I think it's fascinating how it all works. The SI joints are have an approximate angulation of about 25 to 30 degrees at the ilium and the sacrum, from anteriorly lateral to posteriorly medial. The ligaments can be torn and ruptured in those areas, which causes the pelvis to become unstable, and you'll see that in a future slide when we talk about some pathology. But you can see this is a cross section as if you're looking from above. So here you can see where the sacroiliac joints are, and this is the 25 to 30 degree angle from anterior to posterior. So anteriorly lateral and posteriorly more medial, and that's the direction of the angle of these. So when you're positioning a patient, if you can remember that, it's going to help you get them in the right position and recognize that you're going to focus on the elevated side, the side up. And we'll talk about that some more when we get to the positioning. As far as prep goes, dressing and prep instructions are the same for all of the sacroiliac joints and the sacrum and coccyx. So pants off, underwear on, no jewelry, belly button rings, things like that. No button snaps or decoration on the underwear because all of that would be right in front of the area of interest. Shirts with buttons all the way down need to be raised up so the buttons don't show up in the area of interest either. Gowns open in the back. Males can be shielded on all the views, and females can't be shielded on the AP because the area of interest, it'll be obscuring the sacrum and the coccyx on all the views, but you can shield them laterally, and the pictures for positioning will show how to put the shields on the patients. And just like with the thoracic and lumbar spines, if you put the lead blocker posteriorly on the table, posterior to the patient, it will block the scatter from the patient from hitting the image receptor. So you're going to get better detail on the posterior part of the patient. So the typical projections you're going to do for the sacrum coccyx are the AP axials and the laterals. Now in the book it says bowel should be prepped and bladder emptied before examination, and while that sounds all well and good, that's typically not what happens. So if the site protocol where you're working says that you need to do this, then of course you're going to do it. Use your best judgment. Most often it's not going to help a whole lot because it's not like you can tell someone to go have a bowel movement spur of the moment. So anyway, it may work, it may not work, but just keep it in mind. It is in the book. I don't know if it'll be on your national exam or not, but just keep it in mind because they won't, all of that fecal material can obscure, especially the coccyx because it's so small. For the apiaxial sacrum, patient will be on their back for the most part. That's typically how you're going to do it, unless they're really injured and cannot lay on their back or so much pain, then you'll have to do them PA so that they're much more comfortable and they can hold still for you. So, but normally you can pretty much do them AP. So you're centering midline, and you're going to put your central ray 15 degrees cephalad if the patient is supine, and 15 degrees caudad if the patient's prone. So you want to have the CR 2 inches superior to the pubic symphysis at the midline. 40-inch SID, table bucky, your marker is going to be low and to the outside, and you need to have the patient hold their breath. This is what the anatomy looks like on the image. Everything, the median sacral crest should be midline if the patient is not rotated. And you can see where the 15-degree rotation is here, or the angle is here. 2 inches above the pubic symphysis is where you enter. You want to be sure to put a cushion under the patient's knees for their comfort. If their back is injured down there low, it's really hard for them to lay flat like this. So you need to put a cushion under their knees so that they can hold still for you. When you're evaluating your image, you want to make sure you see collimation, and you want to make sure that the angle of your tube is correct for the sacrum angle that they have, the curvature that they have. The pubic bones should not be overlapping on the sacrum. And look for rotation in the ala, right along here. Make sure there's no rotation. You can see your distance here. They should be equal.